This segment of Delmarva Life is brought to you by TidalHealth.
Getting to the bottom of what's going on with your bones. That's what they do at TidalHealth.
And they've recently added bench strength to the team with the addition of certified physician assistant Jimmy Yort, who joins us this afternoon. And you brought in some, well, they look like toys to me.
Beautiful models.
Beautiful models. Okay, so what type of conditions do you treat?
The most common conditions that we treat, well, first of all, I work with Dr. Duran in Seaford, and he's a general orthopedic surgeon, so we treat a large variety of orthopedic conditions.
Okay.
Anywhere from knee and hip pain, arthritis, degenerative conditions, shoulders. Probably the most common that we treat in the shoulder would be either tendonitis or rotator cuff tears. And then some acute conditions in the knee, like we'll say a meniscus tear would probably be a common condition that we would
you see
treat.
a bunch of stuff?
A bunch of stuff, yes.
Anything more prevalent than anything else? I mean, like knees more than shoulders, elbows more than knees?
Knees and hips more than anything.
Yeah.
Yeah.
So what kind of treatments do you offer for these issues?
Really, I like to look at the treatment options for these issues in a stepwise approach, starting with just your over-the-counter medications, your anti-inflammatories, and then if appropriate or necessary, prescription strength anti-inflammatories.
Right.
The other options, taking a step up that ladder, would be rehab, whether that be home exercise programs that we can provide for the patients, or formal physical therapy. Steroid injections, like a cortisone injection, would be probably a term that most people are familiar with. And then if those options have been exhausted, then we look at doing surgery. So surgery really is the last step there in what we have to offer our patients.
Okay, so while we have your toys out, tell us what we're looking at here.
All right, so this first one right here, this is a total knee replacement.
Okay.
So this is where we would replace all the compartments of the knee. The middle model right here is going to be a partial knee replacement. Some patients may have just arthritis on one side of the knee that's affected, and so that allows for a less invasive surgery. And then on the far end there, we have a model of the hip, and that is showing a total hip replacement.
Total hip.
And you get some help with the surgery with the Mako robotic assisted, well, it's a Mako robotic assisted surgery. Tell us about that. The
Mako technology is really impressive, and it's something that allows Dr. Duran to really use precision that is reproducible. Some of the great benefits of that is that it can decrease how much exposure you need during the surgery, which can decrease your recovery time and improve your healing.
Okay. Did you see how he lit up when you said Mako? So let me ask you this. Is there any way that we can, like, preserve our joint health before we get to needing all this?
Probably the best thing you can do to preserve your joint health is to maintain a healthy weight.
Okay.
Whether that be through diet and exercise, or a combination of both. Some patients may need some assistance with medical weight loss, and those options are available, whether it be conservative or bariatric surgery. But I think the biggest thing that we can all do is focus on our diet and keep moving.
Keep moving.
Mobility.
Mobility. Keep
Motion
going.
is medicine.
Yeah. Okay, so TidalHealth Orthopedics has 3 convenient locations. Where are they, and how can we get an appointment?
Yeah, so we have locations in Seaford, Millsboro, and Georgetown. And then we do surgeries at the Nanticoke Hospital, TidalHealth Nanticoke in Seaford. The easiest way to get an appointment is by going to TidalHealth.org.
Make it happen.
Yep.
Yeah.
Gotcha.
All right, physician assistant with TidalHealth, Jimmy Yort, thank you so much.
Thank you.